shut down the whole, what did they say? You create a blockage where they no longer can actually absorb.
So if you take a lot of, so I don't know, there's information out there that when we started seeing a higher incidence of autism was when doctors really started pushing folic acid. And so the theory behind it was, like I said, if you take enough folic acid, it'll make it through, this genetic SNP, and then it'll make the folate cycle spin. It'll decrease homocysteines, and so now it'll convert to methionine, so that baby wouldn't have been a miscarriage, or that baby would have been a miscarriage, but now it's not, and now they have, autism, Asperger's, neurological issues, PDD-NOS, and things that way. I don't know, I haven't really done a ton of research that way, but what can happen though, to your point, is when you take a lot of synthetic folic acid, it increases free radicals. And so that can just put more oxidative stress on the body.
Okay.
And again, somebody might have this genetic SNP and it might not do anything. You can see from mine, I'm homozygous for the C677T gene mutation. I've never had a miscarriage. My kids might be a little weird, I don't know. But and so again, just because you have it doesn't mean that it's gonna cause you any problems.
And there's a big so the thing that I face the most out there is there's no large vitamins and supplements are highly criticized because there's no RCTs demonstrating that this is actually important. Right?
Mm-hmm.
And in a healthcare environment, RCTs are important. That being said, there's no RCT supporting the activated form.
Right.
So my biggest concern is like all of our female supplements have a synthetic folate.
Mm-hmm.
So even for the men.
Oh, and a lot of them have that.
And most of them do.
Right.
And my thing is, can they take that? So and then my other query, and I'll roll it all into one, is PregVit5 is a product in Canada that would, mother risk that everybody should be on PregVit5 because the more folic acid you have, the better. And then as it turned out, too much of a good thing can be not a good thing, and we dialed it back. And they were giving it out because it's a prescription and they can submit it and then it's free. Are you kidding me? Free is not ever free. Nothing is ever free.
Well, it's it's like giving 50,000 vitamin D2.
Exactly.
You don't use D2.
Yeah.
And I sometimes give people 50,000 D3 a day.
Yeah.
People are taking it once a week. So
I guess my thing is, I will often say to people, well, they're not testing, you can do that. And so in lieu of testing, you have this supplement that works generally for everyone. Mm-hmm. Can you, if you know that they have a predisposition to a neural tube defect and or advanced maternal age, can you add activated folate to a product that has a synthetic folate and mitigate that problem?
Yeah, but you also can eat good healthy food that's high in folate, right? For sure.
Okay, so it's not.
Yes.
You're not doing any harm.
No.
Okay, that's what I want.
No, because it's not going to be high. The dose is not going to be that high that it's not going to be offset some way through eat food or things that way.
So the only reason I'm bringing this up is I run into it. That is the number one question I get with either of the prenatals that I.
Oh, I'm sure.
And they're like, "Is it activated?"
That's a hot topic, though.
It is a hot topic, and I'm like, "Well, you don't throw the baby out with the bathwater."
Right. Exactly.
Because there aren't a lot of prenatals available to the lay person that has an activated form.
For sure. Or you could also look at, a lot of your prenatals or multivitamins will have food added. That'll have, green leafy spinach, whatever it is. So then you're going to get some of the activated stuff. So, for me, I don't really recommend.
What do you recommend? It's so funny that you don't recommend prenatals. I'll tell you why. It's okay. You're allowed. Go ahead. Tell them what you recommend.
So I will give them active folate, B12, B6 in a sublingual form. That is a lot. It's like 3 grams of active folate. And then I'll check vitamin D and zinc and all that stuff, and then I'm going to give them what they need from a specific standpoint. And then I just have them do like a green, organic, like greens or vegetable powder to get nutrition from food.
And and she's.
And then I'll do like omega-3s or like cod liver oil or, you know, something like that. So I make it just so specific to the patient that way.
And
But if they're taking a prenatal, I don't have them stop.
what's unique, so I know we're not supposed to be talking about products specifically, and I have an issue with prenatals, and I've got like this comparison, I hate prenatals too. Believe it or not, I hate prenatals, and our prenatal is not actually a prenatal. Ours is a product that is 11 essentials that you can't, the stuff people don't want to eat.
Oh, yeah.
So, you know, nobody likes, not a lot of people like to eat the back of the fish.
Right.
So
Yes.
ours is one of the only ones that actually has the EPA and DHA.
Yep, that's good.
Included in its, suspended in that oil is zinc and B9, et cetera, et
Yep.
cetera. So they're only getting what they can't get from their diets. We always push them to, but if you compare that to all of the other prenatal, they have so much, but so little.
Right.
It's just a little bit of this, a little bit of that. That does absolutely nothing.
Nothing.
And what you're saying to women is to go home, take your prenatal, like your problems are solved, have the O. Henry, the French fries, and everything else.
You're right, yeah.
And they think they're eating properly and getting
No.
everything in
No.
the slow pill, and they're not.
No.
So I hate prenatals.
Mm-hmm.
But having said that, I've been taking our prenatal, which is really, in my opinion, a vitamin that has really good stuff in it.
Mhm.
And I was chronic bulimia.
Mm-hmm.
So we have like 45 milligrams, 50 millimetal iron. It was the
That's
only
good, yeah,
iron,
that's
only
decent.
iron that actually lifted my hemoglobin and my circulating iron levels. So not all, I wouldn't recommend prenatal either.
Yeah.
So, you know, that's the biggest gap right now between Eastern and Western medicine. You know, the scientific research, none of these physicians, I'll just speak to a lot of Chicago physicians, none of them would even consider that,
I know.
right?
I know, but one, that
Right.
that's not their training,
And so-
right?
Right, and so if you can't show that scientific research of delivery and
Right.
outcome and, you know, that this is not a risk or not, you know, you're never gonna be able to get that resolved. And
Right.
that's this gap. You know, I'm
And you know
all
the reason
for
why,
it.
right?
I absolutely do.
Because there's no money, in a
Yeah.
sense, in that,
I
because it's not a drug,
I
right?
absolutely
So,
do. And so,
I do
you
research
know,
every day with my patients, right? I mean,
Yeah,
I
yeah.
know what works,
Right.
you know, I see
It's-
levels, but,
It's like
yeah.
anything, you know, it's like, ooh, everybody's doing biopsies for endometritis. And then, you know, we're doing 14 days of flagells and doxys and then turn around and doing transfers, right?
Mm-hmm.
If you really do more of the research,
Right,
what are we really doing?
Right.
Right, and so you've got the big gap between Western and Eastern.
For
and
sure.
going back and forth, and that's a huge problem.
it's hard,
I
it's hard for
gotta
patients,
tell you,
yeah.
and I'm not tooting my own horn, the only reason the thing that's unique about the ad products that I'm actually communicating is that their formulations were put together based on critical reviewed articles. So there are docs who actually attend all these meetings,
Mhm.
who said, oh, you know what? This works, but we're going to the GNC or going to people, and they're just trying to figure it out on their own. So we actually have science to back up our products, and there's nothing else in there. Like what's on the bottle is actually in the bottle,
Right.
and it blew my mind because we just started production in the U.S. and the FDA did not want a product sample to test. In Canada, we have to provide
What?
not a word of a freaking lie.
Really?
What's on the label was all that mattered. You can put anything in the bottle, but you gotta make sure that label's okay. That blew my mind. And that
Yeah,
tells me
that's
when you're
crazy.
going to Walmart and Costco and all those places, you don't know what you're getting.
Yeah.
And I will tell you, I am shocked by the fact that, when I tried all the expensive iron supplements, nothing, my level, I was a 4, man. I was
Oh
a
my
4
gosh.
to 71. Nothing was working. And within a month, I started to get lift of taking progesterone, this is 45 milligrams. It's like I'm going,
Mhm.
it's nuts to you. I don't know how to fix it.
Claudia, the doctors